would be great. Yes. Let's bow our heads, guys. Dear God, we thank you for another week, another day of life that you've given us, Lord, especially during the pandemic and everything that we're at risk for now, Lord. We thank you for vaccines and medical information that you're giving us now. We ask for your blessing over this event. We ask for your blessing over the presenters and the information that we're going to obtain from this presentation, Lord. And we ask that you direct the path of this event, and also help this to be beneficial to everybody here. Hopefully everybody here has questions, experiences that they can share. We want to learn from each other today. Thank you so much for everything, Lord, that you do for us. In Jesus' name we ask this. Amen.
Amen. Thank you, Brother Julio.
You're welcome.
I am actually going to share my screen, but as I do that, I want to welcome everyone again. Thank you for coming. I am actually very excited that we have Dr. Shin joining us and Pastor joining us. It's going to be an awesome presentation, so please just drop questions whenever you want. We're going to start off with me kind of giving you a little bit of an update on the COVID situation, the numbers, the vaccines, things that are kind of more recently in the news. I feel like the last time I talked to you about vaccines, about COVID, it was probably, I feel like March, April of last year. So it's been several months since we've done that. So this is going to be an interesting follow-up of all that. After me, I'm just going to be talking very briefly, but after me, it's going to be Dr. Shin. He's going to go much more in depth into kind of the vaccines, what they're like, why they're helpful, why they're useful, any questions about that. Hopefully we'll address that. And then to kind of wrap up the night, Pastor is going to share his experience with vaccination. He's not the only one who's gotten the vaccine. I know we were talking about that earlier in this group. So any questions that anyone might have, we can also answer then. In fact, we've set aside the majority of the night for questions and answers. So please keep thinking of questions. I'm really excited to hear that many of you wanted to start discussing this, to ask questions. So that's so exciting. And I'm very happy to be here. Anyway, I'll start. That was my TED Talk. So I'm going to start with this first slide that is just the heart telling the brain, saying it's okay not to have all the answers. Super okay, which I think is probably going to be the theme of a lot of the things that we're going to talk about. Remember when all of this started back in February, March of last year, right? It's been almost a year now. We were talking about, oh, well, we don't know if we should be recommending this, and we don't know if we should be recommending this. And, if you're high risk, do this. And we just didn't have a lot of information about COVID and this new infection that was coming from across the world, right? Now we have a lot more information. I'm not going to pretend that we have all of it, right? We have a lot more data. We know kind of what to do when we see this infection in the hospital. Nobody is going to say, oh, I don't know if it's going to affect the kidneys. I don't know if it's going to affect the brain. We kind of have the general pattern of what a COVID infection looks like and how to respond to it, which I think is great for those who are sick. We also know a lot more information about how it spreads and what we should be doing to control it. But now that we have this next step in the process, which is vaccination, we are gathering information. We are providing people with that information as we learn it ourselves. So I encourage everybody during this presentation, after this presentation, there are sources of good information and bad information, right? Make sure that we are choosing information sources that are not biased, that are not heavily opinionated by people who have one idea versus another, who might not necessarily be, say, as educated on these topics. And I know a lot of people feel very strongly about some of the ideas that we're going to talk about today. So I just want to encourage everybody. If there's a question you have that we haven't talked about today, or you don't believe us, which is okay too, I want you to check out these websites. cdc.gov is where I got the majority of the information for my part of the presentation. vdh.virginia.gov is specifically for the state of Virginia Department of Health. So I know most of us, I think, live in Virginia. So I'm going to be referencing some of the Virginia statistics. So I encourage you to check out that website as well. I think that would be another good source of information. But if you live in Maryland, if you live in DC, wherever you might be listening in from, check out the Department of Health in your state or in your county, because that is where the public health figures, the doctors, are putting the information together for your accessibility. Sometimes the news makes money by painting things in a very dramatic way, right? And other people get a lot of likes on social media when they paint things in dramatic ways. Let's make sure we're choosing our sources wisely. And it's okay not to have all of the answers. Okay, that's my second TED Talk of the day. Let's get started. So I have a bunch of graphics, okay? So here's where we are in terms of COVID-19 cases right now. This is in the entire United States. You'll see that there's about 28.2 million total number of cases. Average number of daily cases per 100,000 people, particularly averaged over the last week, was about 20. And then the total number of deaths is about 500,000, okay? I like this chart. You guys have probably seen some version of this chart on the news about how the daily trends in COVID-19 cases and deaths are changing. So this is actually just since January, just since January 22. So it's not the overall trends from last year. But if you just notice that the trends as the infections were increasing, I'm so sorry, it starts at January last year. As the trends increased, you can see the total number of daily cases as they rose, maybe about like October, November. And then you can see it peak right over here. I don't know if you can see my mouse. You can see it peak right over here. And then luckily, fortunately, we're actually on the downhill, right? It's not as high as before, although there is a little bit of a jump right at the end. You'll see right where February is. You'll see that it was mostly heading down, but there are a lot more variants and things like that that might be confusing the picture, and we don't really know what's going to happen, right? If we were to paint this picture maybe a month ago, I don't know that we would have been able to paint this graph and predicted which way it was going to go. So this is kind of the overall picture of cases and deaths. I want to show you the number of vaccinations, okay? So vaccinations started in about mid-December. A lot of our frontline workers started getting vaccinated then. I actually, luckily, was one of the first people to get vaccinated. I got it the first week that it was out. So that was me, all the way down there at this end of the chart, right? And then you can see that the number of vaccines that have been available are gradually increasing. We're actually almost at a point that almost 1 million people are getting vaccinated across the United States on a daily basis, which I think is great. And this has been limited both by distribution of vaccines, but also availability of vaccines, right? So you can take a look at the graph right up here. Again, this is all from the CDC website. The amount of vaccines that have been delivered, total doses, is about 70 million. The amount of the population that has been vaccinated so far, just with one dose, is about 14%. And then fully vaccinated is about 7%, people who have gotten both doses, okay? Now, the US has a huge population, so what this really amounts to is millions of people who have gotten at least one shot, right? Almost 50 million people have gotten at least one shot, which is fantastic, considering how quickly everything has gone through. Now, I want to give you a little bit more specific information about our region, because sometimes we look at the big picture and we think, that's probably just in California. That's probably just, in the city. And I don't know if I can get this because I live in Montana or whatever. Let's look at our data, right? Let's look at Virginia data and see how we're doing. Now, COVID-19 in Virginia, and I'm just going to present Virginia for now, okay? COVID-19 in Virginia, there have been about 500,000 cases. Hospitalizations of that 500,000 cases is about 24,000. And the death toll just in Virginia is about 8,000. And this is up to date as of today. You'll see that it was last updated today, okay? How this compares to vaccinations in Virginia. So you'll see that the total number of doses of vaccine in Virginia that have been administered are actually 1.8 million people have gotten at least one dose. And you'll notice that there's actually 587,000 people that have been fully vaccinated. That's kind of exciting to me, because that means 587,000 people are fully vaccinated when our total number of cases, that we've had in Virginia is like 572. Can you imagine that? Just that comparison, we can see how many people we are getting vaccinated, and we're heading in the right direction, right? So I thought this was a really encouraging number. It attests to how well Virginia is doing. And if you wanted more information about what Maryland or what your state is doing in particular, CDC actually has websites for every 50 state. You can go on there, you can see how is Arlington County doing, or what is Florida doing. I have parents in Florida, or whatever you want to check. They actually have vaccinations listed out, the number of vaccines available. They have each of the vaccination phases, like are they in phase 1, phase 2, like where they are per state is all on the CDC website. It's a great one. I highly recommend it. Let's keep going. So I've talked a lot about the numbers and what's been going on and how many people have been vaccinated. I want to kind of introduce the subject of why we should vaccinate. And I want to split this up into two main ideas, okay? The first is you should vaccinate because COVID is a bad infection. The second is you should vaccinate so that we can protect other people from getting infection, right? The first part I wanted to talk about is we have a little bit more information about what COVID does. Remember, I alluded to this before. First, we thought maybe it was a respiratory illness, a flu-like illness, but now that we have a little bit more information about the progression of this disease, both in young people, old people, children, infants, we kind of can tell pathologically what it does. Initially, it's a viral infection. It's a viral response phase. That's that very first stage. A lot of people are asymptomatic, especially if you're young and healthy, you are asymptomatic during this phase, right? After that, and it can be very quickly that it progresses, it causes what we call a cytokine storm or a hyperinflammatory phase. And that's this red marker. That's like the stage 2 and stage 3 that you're seeing kind of in the second half of the chart. And what does that mean? Inflammation does not just happen in the lungs. If you think of inflammation, many people will think of like your joints getting inflamed and arthritis, right? That can happen anywhere in our body, and it's our body's response to something that's not supposed to be there. So if there's a bacteria there, there's a virus there that's not supposed to be there, our body's defense mechanism is to get inflamed and try to fight it. When it's hyperinflamed, that means it's in that defense mode, it's at war for too long and it's going too hard and it's actually damaging our own body. That's why COVID-19 has been shown to affect the heart. It can cause heart failure. It can affect the brain. It causes seizures. It causes meningitis. It causes encephalitis. It causes thinking and memory problems, by the way. And a lot of people that are young and get this infection and then recover without any symptoms, I'm seeing them in clinic for memory problems now. It causes kidney failure. It can cause kidney failure. It can cause GI issues. It affects multiple systems in our body, not just the lungs. And it's not just that the hyperinflammatory response only occurs in patients that are greater than 60 years old, right? This can occur in a child. And I don't know if you guys remember reading articles about children that got that systemic inflammatory response, right? It can happen in children. It can happen in young adults. It can happen in older adults. This is something that our body does to protect ourselves, and then it gets blown up to involve the entire body. That is why vaccination is going to help protect you from getting this infection, not just getting a flu-like illness, but this giant inflammatory infection that can cause problems in different parts of our body. It's a serious illness, right? And we've seen how many people die from this. So that's the number one reason that we should think about is we don't want to get sick from COVID-19. I don't want anybody to be thinking, oh, I'm young, healthy, I'm probably not going to get it kind of a thing. Now we know that anybody can get it, right? The second part is this idea of herd immunity. And I'm sure you guys have heard this over and over again. Let's walk through it just to make sure we're all on the same page, okay? So if you look at this graphic, the first section, the very top part of it, the little blue people, those are uninfected people. They're still healthy, they're asymptomatic. But you can see they're all kind of huddled around the red people, the little red people, you see them? The little red people are not immunized, they're sick, and they have the disease. These are the contagions, okay? These are the people who have COVID. So you can see that when no one is immunized, there's just a bunch of healthy people minding our own business, but there are two people that are sick. It can spread very quickly when there is no immunity in a group, right? Look at this next section right there. Almost everybody turning red because they just don't have any immunity to fight this illness, right? Now, let's see if somebody has some immunity. For whatever reason, they had the COVID infection already, maybe a month ago or so. And so their body is recognizing this illness. There's a few of them, maybe like 5 of them, right? Compared to the 2. You'll see that there's less people getting sick, but it's still pretty prevalent, right? How much they're getting sick all over the group. It's almost just as bad as the first one. Now imagine if a large chunk of the population was vaccinated or had immunity in some way against an infection, and this is not just COVID infection, right? This is any kind of infection, then even the 4 people that are not vaccinated, see the little 4 blue people, they may still be able to stay safe, right? While the rest of the population may still be able to stay vaccinated and healthy. And the 2 or 3 people that were sick, maybe they'll spread it to one more person, but it's not causing a mass effect like it did in the first 2 panels, right? So this is what herd immunity implies. It's that when some part of the population or majority of the population develops an immunity or recognition of an infection, then they can protect those who are not immune just by nature of your containing the infection. You're containing the amount of people that can transmit it because you've developed some kind of immunity. Now, the number of yellow people that we need, number of people that need to be vaccinated is different depending on how contagious a disease is, right? So if there's something that is not that contagious, for example, Ebola, like that is, we don't really see that in the United States as much anymore, right? The number of people that are vaccinated against Ebola in the United States is probably 0. I don't actually know if we even have a vaccine, probably not. But think about it for COVID. The number of people, the amount of COVID that's in the United States is so prevalent, right? We saw how many numbers there are right now. There are 28 million cases in the United States. That up there, experts are saying around 60% at least of the population needs to be immunized so that we can start to contain this virus, so that those who can't get immunized might stay protected, or those that don't get immunized might still be protected, and they can be in those groups of little blue people. Okay, that's kind of the idea of herd immunity, where if we work together, maybe we can protect other people as well. Now, I'm gonna keep moving along. I don't want to take up too much of Dr. Shin's time too. I wanted to just give you a quick update on where we are in Virginia. Again, go back to the CDC website to see where your state is if you're not in Virginia. In Virginia, we're in phase 1A and 1B. 1A is the very earliest stage where we were vaccinating healthcare personnel, frontline workers, essential workers, and residents of long-term care facilities. If you guys remember, there was a huge outbreak, right, amongst our elderly patients who were living in long-term care facilities. Just so many of the deaths were coming from those facilities. So we vaccinated them first. We vaccinated the people who were getting exposed. These are the people that are closest to the red, if you can imagine. So they're the ones in the inner circle. We vaccinated them, trying to contain as much as we can of the disease. The next step, when we started rolling out more vaccines, of course, is phase 1B, which is kind of where we are right now. As we start to accumulate and deliver more vaccines, we are now getting to some of the other essential workers. We're getting to people aged 65 and older. We're also getting to people aged 16 to 64, but have underlying medical illnesses. I'll kind of give you a snapshot of what that means in the next slide. So anybody who might be prone to having serious complications from COVID, and we've discussed that before, right? We're starting to vaccinate those folks too. In addition, we're also vaccinating people who might be in contact with other people, like faith leaders, like pastors, people who work in homeless shelters and migrant labor camps, those kind of things. So that's where we are in Virginia. The next step, obviously, is to start vaccinating people who don't necessarily have underlying medical conditions and other essential workers. Here's a quick snapshot of where we are in phase 1B, just a little bit more in depth. So you'll see that the people right here is where I feel like the majority of people will be. Certain conditions or disabilities that increase their risk of getting serious illness from it. There's a list of those medical conditions actually on the website if you want to check it out. But think lung disease, think immunocompromised, anybody who's on like chemotherapy or cancers, or if you have like an autoimmune illness that you have to take very serious, strong medications for, think those kind of things, as well as those who are 65 and older. I think that's the last slide I've got for you. I did see many questions come in. I promise we'll address them, but I think we should give Dr. Shin a chance to kind of see if maybe we can answer some of these questions first. So Dr. Shin, would you like to take over? Maybe?
All right, thank you. Let me share. Oh, I think you have to stop sharing your screen.
Oh, I definitely do.
Okay. Well, thank you so much, Dr. Jenn. That was a really informative introduction, and I feel like you set the information stage really well. So what I'm going to do is I'm going to try and get through as much information as I can in the time that we have, in order to save enough time for questions at the end, because that's ultimately what's most relevant for everyone. And I do have a hard stop because I have to give another presentation starting at 8:50 for a group in California. So we'll try to stretch out the time as much as we can. So everyone seeing my slide okay? Okay. All right. So I just want to cover the vaccines very quickly. And here are some of the vaccines that are coming down the pipeline. And of the ones that we see here, um, the Pfizer and the Moderna vaccines are the only ones that are currently available to us in the US. Okay, and these are both mRNA type vaccines, and I'll get more into what that means. The AstraZeneca Oxford vaccine in the UK, along with the Johnson & Johnson vaccine, which is coming down the pipeline, they're both adenovirus vaccines. And then the Novavax is a protein subunit vaccine, which is more of the kind of vaccines that we're familiar with. Okay, and hot off the press, as of today, the FDA advisory panel voted in favor of Johnson & Johnson's vaccine. And so very shortly, we anticipate that it will be also granted an emergency use authorization from the FDA. So in this country, we will soon have 3 vaccines available. The main difference between the Johnson & Johnson and the Pfizer and Moderna vaccines is that the Johnson & Johnson requires only 1 shot. You don't need 2 shots, okay? All right. And if anyone who is not talking can mute, because I think people who are unmuted, we can have the sound coming in and out, and sometimes that can be distracting. So if you can please mute. All right, so how do these mRNA vaccines work? So the reason why a lot of people are sometimes confused about these vaccines is that mRNA technology has been around for a very long time, but this is the first time we've seen it in the form of a vaccine that we're giving to the mass public. This research is not new. This research has been around for decades, but we haven't had the public push, if you will, to put it into a vaccine form until this COVID-19 pandemic came along. And because the pandemic came, the different researchers around the country and around the world who are working on this new platform, this new technology, decided now is the perfect time to put this technology to use. So how does it work? So we've all seen diagrams of the coronavirus, okay? The thing that distinguishes a coronavirus is that in its outer surface, they are studded with these spike proteins. And the spike protein is what the coronavirus uses to glom onto certain receptors on your cells in your lungs and gain entry into your body. Well, it also turns out that these spike proteins make a very good target for your immune system to learn and recognize and say, hey, if I see this thing, then I know I'm fighting this coronavirus. So what scientists have done is they've decoded the genome basically of this virus, and they've taken out that little RNA sequence that codes for the spike protein. And these is called messenger RNA, and that's why you see the mRNA. And messenger RNAs are very unstable. They exist in a form within your cells that lasts for hours, maybe, at most days before they're degraded. So the question was, okay, we can get this little transcript that codes for the spike protein. How are we going to deliver it into your body's cells so that they can start producing it? Well, that's where the big hangup was in this technology for the longest time, until scientists finally discovered that if you coat it in this, what they call a nanolipid particle, which is basically globs of fat, very, very tiny globs of fat to act as a shell to help transport this mRNA, then it can remain stable long enough so that you can deliver this vaccine to the cells where it needs to be taken up. So what happens is these mRNAs are protected in these little droplets of fat, and they get injected into your shoulder. And what happens is that these little droplets of fat then get taken up by various cells in your body, including the immune cells. And the RNA then gets released inside that cell And the RNA is read by the cell, and the cell starts producing the spike protein, which the RNA codes for, and it expresses a spike protein on the cell surface. Then your immune system looks at that and says, hey, this is strange, I haven't seen this before, so I'm going to start creating antibodies against it. So antibodies are the weapons that your body uses against anything that is foreign in your body. And so it learns to recognize the coronavirus without you actually being infected. Now, just so, because not everyone understands how RNA and DNA works, this is the major difference between the two. So you can think of your DNA as like a book, a cookbook full of recipes, right? And the RNA is like a Xerox copy of one page of one recipe. So you have this cookbook that has all the recipes that you love to make. And one day you decide, I'm going to cook vegan mashed potatoes. And so you don't want to stain your cookbook. So you go ahead and take it to a copy machine and you make a copy of that one page. And that page you take to your kitchen and then you make your vegan mashed potatoes. But after a while, you know, that page, it gets wet because you're splashing water on it, food gets on it, it gets dirty, the dog comes over and chews it up, it gets destroyed, you know, it goes away. So the cookbook is the DNA. The mRNA is like that Xerox copy, okay? It's the same information, but it's a temporary copy that allows you to execute the instructions in there. And in the case of this vaccine, the mRNA, this recipe is a recipe for the spike protein on this coronavirus. And one of the things that people have lots of questions about is, does this vaccine modify me genetically? Do I become a mutant? Is this a genetic experiment? And the answer is no. And the reason why is because the DNA, the cookbook of your body, is not changed. The only thing that this vaccine is inserting into your cells is RNA. And RNA are the Xerox copies of the recipes that are found in your DNA. But this particular recipe is not in your cookbook. So it needs to introduce this temporarily into your system. So the mRNAs come into your cells, and for a temporary amount of time, they produce these spike proteins. And after several days of doing that, they get destroyed. So one, you don't become genetically modified. This is not something that you pass down to your children and their children's children. And two, you don't keep making spike proteins for the rest of your life. You don't become a spike protein making factory and you just live with that. No, it's temporary and it goes away. So the net effect is identical to all traditional vaccines, which is a temporary exposure to a finite amount of foreign substance that teaches your immune system how to recognize it when a real infection does come your way. Okay. So what is the effectiveness of these vaccines? So let's look at the Pfizer vaccine, first of all. This diagram came from the New England Journal paper that highlighted the vaccine efficacy from its large phase 3 trial. And the numbers I want to highlight here are found in this column here. So in the two groups of people here, so they kind of sliced and diced it between patients who did not have any evidence of infection, you know, after their second shot, and then patients, even those who had a history of infection. But in either groups, whether the vaccine group or the placebo group, we can see that there was a 95% effectiveness rate or efficacy rate. So in other words, 95% effective at preventing the COVID-19 disease from taking root. How do we see that? So there was 18,000 people in the vaccine group here, 18,000 people in the placebo group. And of these people, there were 162 cases of coronavirus, but in the vaccine group, you can see there were only 8. And down here, the numbers were pretty similar, 169 infections in the placebo group and only 9 infections in the vaccine group. So this is how you know there's a real difference. This vaccine really did prevent a lot of coronavirus infections in the vaccinated group. And that's where you see the 95% result come from. What about the Moderna vaccine? So this is how the Moderna vaccine reported out their data. And this is a graphical way to visualize it. So you can see over time, the gray represents the placebo group, the blue represents the vaccinated group. And over time, as the days go by, you can see that the curve of the number of people who are getting infected in the placebo group keep rising and rising and rising. But you can see that the rise is much, much lower in the vaccinated group. And you can see the absolute numbers here between the placebo and the vaccinated arms. And they found that their efficacy is basically 93%. So some people look at this and say, oh, well, then it's better to get the Pfizer vaccine because they're 95% and the Moderna is only 93%. Well, when you try to split hairs like that, given the tolerances and the confidence intervals of these two trials, we will call them essentially identical in their effectiveness rate. So between the two of them, Moderna and Pfizer, equally effective. That's the bottom take-home message. So then some people say, well, yeah, these were large trials, but large trials don't give you the full information, right? What if the numbers are actually different? Well, I'm happy to say that we're actually seeing that these numbers are holding true in the real world. So in Israel, the largest HMO in Israel collected data on over 500,000 Israelis that they vaccinated. And they found that the Pfizer vaccine, which they're using at the moment, is showing a 93% effectiveness rate in preventing COVID-19 among the people who are vaccinated. And they just recently published on February 24 in the New England Journal of Medicine this data, which shows that essentially, this is the code name for the Pfizer vaccine, that the Pfizer vaccine in a nationwide mass vaccination program is showing that the effectiveness rate seen in the clinical trial is bearing fruit in the real world. And this is extremely encouraging data because now we can see the clinical trials were done correctly. Their data was reported truthfully. And we can trust in the numbers that we're seeing reported in the clinical trials because we have independent verification on a massive level in the country of Israel with 500,000 people. So this is very exciting data for anyone who might doubt the effectiveness of these vaccines. So here's a question. If the vaccines are so effective, why do we still have to mask and socially distance? That makes no sense. And I know some people are thinking, this is crazy. The reason why we're getting vaccines out is so that we don't have to do this nonsense of masking and socially distancing, but we still have to do the same things and still get vaccinated. Then what's the point? Well, keep in mind that the vaccines are 95% effective. That means you don't know if you're in that unlucky 5% that's not protected by the vaccines, okay? So even if you get the vaccine, you shouldn't think that you're invincible because if you're in that 5%, you're still vulnerable to the disease. Another major reason for continuing to socially distance and mask is that the vaccine trials didn't look for asymptomatic transmission. What that means is the way they conducted the trials is they said, here's a group that's going to get the vaccine. Here's a group that's going to get placebo. We're going to follow them over time. And the moment someone gets a symptom, we're going to test them and see if they have COVID-19. If you were never symptomatic, we're not going to test you. So we don't know if there were people, silent carriers, if you will, in both groups where they got infected, but they never showed symptoms. And so that was never documented in the trial. So in the vaccine group, we know that for a fact it prevented symptomatic COVID-19 compared to the placebo group. But were there people in that vaccine group who had the infection and didn't know it, and so it never got registered? We don't know. Now, the science tells us that it's highly unlikely for that number to be significant. And we're getting good real-world data now that shows us, especially in Israel, that when you get the vaccine, the chance of asymptomatically spreading the disease without knowing it is extremely low. Okay, so that's reassuring. But until we have actual clinical data that proves this, where people are getting tested regardless of whether or not they have symptoms, we cannot definitively tell you, hey, this will stop asymptomatic transmission as well. Therefore, if you're vaccinated, take your mask off and do whatever you want. So we can't say that. However, the science is leaning in that direction. So until we have that conclusive data and until everyone's on board, it's good for everyone if you continue to mask and socially distance because we don't know for a fact. Okay. Another reason is that vaccine rollout has been pretty slow. So the best way to stop transmission for now is to continue to mask and socially distance. And as you know, It's easy to tell one or two people how to conduct their lives and to do things, but to educate millions of people, Geethika works in public health, it's like herding cats. Trying to make millions of people do the same thing is extremely difficult. And to teach them things, you have to keep it very simple. So if you have one set of instructions for one group of people who are vaccinated, another set of instructions for people who are not vaccinated, another set of instructions for people who are partially vaccinated, it's a nightmare in terms of trying to get this public health message across. So the message is remaining the same for everyone. Continue to mask and socially distance, because that is the most secure way of decreasing transmission. So then what about these mutants that we keep hearing about, right? And they're concerning. And there are people who think, oh, isn't that convenient? Just as the vaccines are rolling out and it looks like now it's going to be effective and life is going to get back to normal, the powers that be are saying, oh, there's these mutants coming down the pipeline. And so now these aren't enough. You might have to get a booster and you might have to still do this and that. And so there are many people who are understandably pandemic fatigued out. They are just sick and tired of COVID-19. And they thought that the vaccines were the light at the end of the tunnel. And now we're hearing things about mutants. And they're like, okay, is that light an oncoming train? Does that not mean anything for us? Is life never going to get back to normal? Well, a little bit about mutants. So the reason why mutants form is because every time a virus replicates, so it infects a different cell, and that cell creates copies of itself, and it sheds them and spreads out to other cells. Each time that's copied and transmitted forward, i.e. replicated, there's a chance of making errors when they're copying, okay? So just the same way that if I gave you a book to copy by hand, you can very well make mistakes, and the number of times you have to copy it, the chance of making a mistake increases. The same thing with an RNA virus. The chances of them making errors in copying their viral material, their genetic material, increases every time they do it. So every time a new person gets infected, every time you transmit the virus to someone else, that's another opportunity for the virus to mutate. So mutations, it's not a question of if they will happen, it's a question of when they will happen. And some viruses mutate faster than others. We have to thank God that the coronavirus is, for an RNA virus, tends to be on the lower ends of the mutational spectrum. And I think someone needs to mute their microphone, because I think we can still hear some audio. So coronaviruses, compared to, say, influenza viruses, mutate very relatively slowly. But the massive number of infections globally is taking that small mutation rate and still making significant mutants appear in the wild. And so that's why we have names of mutants like the UK strain, or the South African strain, or the Brazil strain, and now the Californian strain. It's named after places where these mutant strains were first found. And the way that it works is that in order for a mutant strain to take hold in society, that means it has to have some advantages, right? If you have all sorts of different coronaviruses flying around, if you're a mutant and you mutate in a way that's less effective to transmit and replicate as a virus, you're going to be weeded out and you're not going to spread as fast, so you'll disappear. But if you're a mutant who can, say, infect more effectively, you can cause sicker symptoms and do these things, then chances are that you're going to win the race in terms of infecting numbers of people. And so your mutant strain starts propagating faster. And so that's why we see blossoms of these mutant strains emerge in different parts of the country. And they tend to be more contagious and sometimes more deadly and more resistant to vaccines because of these very reasons. So of the strains that I put up here, these are kind of the major ones that we're worrying about. And there are many, many more. But of these strains, the Pfizer and Moderna vaccines have shown that they're very effective against the UK strain. The South African strain is providing a problem. So the Pfizer vaccine was reported as having 2/3 less of a response, and the Moderna vaccine was reported as having about 6 times less efficacy. Now that sounds like a lot, but you have to take it in this kind of a picture. Let's say that this is the threshold of immunity that you need to protect yourself against coronavirus strain, okay? These vaccines, both the Pfizer and Moderna vaccines, the immune response they generate is somewhere up here, really high. It's like overkill, way above what you need to protect yourself against coronavirus. And now here comes some mutants, and it knocks them down by 2/3 or half. We're finding that it's still above this threshold of effectiveness. So we have good reason to believe that the vaccines are still efficacious. However, we're getting close to that threshold where now it may not be effective. And in this South African strain, we are having concerns that some of the vaccines that they're testing are actually lower in their efficacy rates, so around the range of 50 to 60% instead of 80 to 90%. So we're not talking about zero efficacy, but we're talking about efficacy rates that are more on par with the flu vaccine that we get every year. Because if you think about it, in the world of vaccines, 95% efficacy is unheard of. That is like in our wildest dreams, we could not have wished for a vaccine that effective. So some people in the public who don't know this hear 95% and they say, well, why couldn't they make it 99%, you know? And they quibble about that, but you have to understand that the flu vaccine that we get every year is anywhere from 40 to 70% effective, give or take, you know, depending on the year. So bottom line, are mutants a problem? Definitely a problem. Do we have mutants out there right now that are devastating because they're completely immune to the vaccine? There's no evidence of that yet. And I say yet because the longer this pandemic goes on and the more people who don't socially distance, who don't mask, and who keep spreading the virus, the more that happens, I guarantee you that eventually there will come a form of the virus that will be completely immune to our vaccines. And then we have to start from scratch again and create a new vaccine. So for this reason, in order to try and boost the efficacy, even though the vaccines are still effective enough to take care of the viruses, the companies have decided to develop what they call a booster shot. A booster simply in an abundance of caution to boost your immunity, which is probably still okay, but they want to be extra sure that they're covering all their bases, so they want to create a booster that's going to cover some of these new strains coming out. But remember, unless we stop transmission, we're not going to solve this mutation problem. So now the big question, how do we know the vaccines are safe? So let me go cover for you the safety data found in the trials, and then I can cover some more specific concerns. So here's the Pfizer data. Now I know this might look a little strange, but so for people who are above 55 years of age, there are separate graphs for those who are below 55, between 16 and 55, but for space reasons, I didn't include those. But for people who are older, 55 and older, these are the kinds of symptoms that they experience after the vaccine. So you can see fever, fatigue, headache, chills, vomiting, diarrhea, muscle pain, joint pain. So basically, symptoms that are consistent with having the flu. And that's essentially what people say. When they get this vaccine, it's very reactogenic. Reactogenic means it causes symptoms. And this is what scares a lot of people because they say, well, I get the flu shot every year and I never have symptoms like that. I just have some arm soreness and it goes away. Or whatever vaccines I get, tetanus shot, anything. I just have soreness and that's it. I've never had a fever because of a vaccine. That's kind of scary. What's going on? And what's going on is that these vaccines are so effective precisely because they activate your immune system so strongly. They stimulate your immune system in such an effective way that your immune system mounts this big response, and that is what you're feeling as symptoms. And the same thing happens when you actually get a viral infection like the flu. You get fevers and chills and headaches and myalgias, muscle aches, because your immune system is activated. But unlike a real infection, in the case of the vaccine, your immune system is being super activated, but you don't have viral particles replicating in the millions and billions. You just have these benign spike proteins that are just causing a frenzy with your immune system without actually damaging your body. So what's the difference between these two graphs? So here's after dose 1, you can see the percentage of people experiencing certain symptoms. Okay, so around the 40% range for fatigue, headache, 30%, and maybe around 10% for vomiting, diarrhea. Well, vomiting is much lower, muscle pain. But you can see that after the second shot, more people develop symptoms. Many more people develop fevers, fatigue, headache, chills, okay? And so what this means is that when you get the vaccine, you should expect a higher chance of getting symptoms after your second shot. Why? Because after your first shot, your immune system has begun to learn about this virus. And so it develops the ability to mount a response. And then when you get your second shot, the heavens are open, if you will, and your immune system pours itself out, and now it's able to respond much quicker, much faster, and so the chances of symptoms go up. Okay. Here's the safety data for the Moderna vaccine. So again, similar symptoms: fever, headache, fatigue, myalgias, arthralgias, nausea, vomiting, chills. And you can see after dose 1, dose 2, and they have the placebo and vaccine arms in here. But after dose 2, you can see that this height is like 75% compared to 50% here. This height here is around 55% compared to here, which is around 30%. So just like the Pfizer shot, the Moderna shot, you have a much higher chance of getting symptoms after your second shot. But again, it's limited to symptoms like these. Now, it seems like you have a higher chance of also getting symptoms if you're younger. So if you are less than 55 years of age, your immune system is stronger, more robust, it's capable of mounting a greater response. And so this is why we think that younger people tend to have more significant symptoms. It seems like the older people take the shot and they say, oh, that was nothing, I didn't feel anything. And the younger people have to take a day or two off work because they're laid up in bed feeling like they have the flu. Now, here's an important point. After you get the shot, the symptoms should resolve within 48 hours. If you have symptoms beyond 48 hours, it is not the vaccine. And you may want to get yourself tested to see if you actually have some different kind of illness. Now, how safe has the vaccine been? Because the data I showed you pertains to the trials, which were large, but it doesn't tell you the full picture of what a population might experience. Well, this is hot off the press. You see it's last updated February 25. And the CDC says that over 63 million doses of COVID-19 vaccines were administered in the United States from December through February 21. And they received, so theirs is the Vaccine Adverse Event Reporting System. This is just a database where anyone can report an adverse event following a vaccine. It doesn't mean that it was caused by the vaccine. The CDC wants you to report it because they will sift out whether or not it's caused by the vaccine. So you have reports in there, people getting into car accidents after a vaccine, people who get into a domestic abuse issue because they have a fight with their spouse and then they report it to theirs. So obviously these things are not caused by the vaccine, but they want people to report. When in doubt, just report. And so in that number, there's 1,099 reports of death following a COVID-19 vaccination. Now, vaccine opponents like to really misuse VAERS data because they will take that one little comment out of context and they'll say, you see, after COVID-19 vaccination, there were 1,099 reports of death. How can you think of getting this vaccine? And it sounds terrible. But if you look at it this way, that the 1,099 reports of death, out of all of them, when the CDC and FDA physicians did a medical review, they said, including looking at their death certificates and all their clinical information, autopsies, they revealed that there's no evidence that vaccination contributed to patient deaths. Okay, so that's a very strong statement. Now, does that mean that they know for sure 100% that the vaccine did not play a role in any of these deaths? No. What that means is that to date, the VAERS system has not detected patterns and cause of death that would indicate a safety problem with the COVID-19 vaccines. This is what you have to understand. If you have a cohort of millions of people, if you have an adverse event rate that's even a fraction of a percent, that's going to generate tens of thousands of reports, okay? How do you know if a report in a system like theirs is due to the vaccine versus due to something else? The only way to know is you say, what did adverse events of that kind look like in the general population before the vaccine was given? And then you subtract that baseline number from the new number you're seeing after the vaccination. So let's say, for example, there were, according to the CDC, there were about 2.8 million deaths, I think, in 2019. And out of those deaths, if you look at it, if you take a cohort of people, about 28 million big, because that's roughly the number of people who are fully vaccinated in the US. In a cohort like that, every day, 667 people will die from that group of people of that size for some reason. 667 people will die every single day by random chance alone. What are the odds that some of these deaths will happen shortly after getting a vaccine? Statistically, the chances are very good, because if you have 667 deaths per day in this group, then some of those deaths will happen maybe within 24 hours of getting a vaccine. And then people will report it and say, wow, he got this vaccine, and 12 hours later, he was dead. But if you read the various reports, a lot of them, you can tell that these people were sick with a lot of other things. They were in the nursing home. People were expecting them to die anyway. And then there are unfortunate cases where strange things happen, where people develop bleeds, or people develop strange, what seems like neurologic issues, or people develop anaphylaxis. And those are the things that the FDA and the CDC look at very closely and say, okay, those things still happen in the general population even before vaccination, but are they happening at a greater frequency post-vaccination? And as far as they can tell, the answer is no. So what that means is that the vaccines are not creating an uptick in the number of these strange health problems that are prevalent in our society anyway. And that leads them to believe that the vaccines don't have a safety concern. Now, is it possible that some of these weird health problems are being caused by the vaccine? Absolutely, it is. But we should be reassured that if it's the case, it's still low enough that it's not moving the needle in our population incidence of these weird side effects, which means that it's overwhelmingly safe for the overwhelmingly majority of the population. So what about anaphylaxis? You hear about anaphylaxis in the news. So anaphylaxis is basically the most severe form of allergic reaction that you can get. And it can be life-threatening if you don't treat it immediately. You have no idea who will develop anaphylaxis. If you have a history of having had an anaphylactic reaction to something in the past, then that's a good indication that you're at higher risk, but you still don't know for sure. So anaphylaxis is quick. It usually occurs within the first 30 minutes. And it's rare. It's so far, we see it in about 2 to 5 million people who get the COVID-19 vaccine. But just to put that number in perspective, fatal food-induced anaphylaxis is seen in about 1 in 4 million adults. And this is just fatal, not just incidence of anaphylaxis. So if you're not afraid of eating a mango or a banana, you should not be afraid of getting the COVID-19 vaccination, is what I'm going to say. Because I actually have a patient whose son died from a banana allergy. He didn't know he was allergic to bananas, and he had an anaphylactic case and died. And that was a real tragedy, and no one's making light of that. But because I told you I know someone who died from eating a banana, are you going to remove bananas from your diet? And I think the answer is no, because we all know that deep down, bananas are very safe for the overwhelming number of people. But for the few people who react poorly to it, it's devastating, and that's terrible. But we still don't withhold bananas from the population because we know that for the most people, it's safe. And that's exactly the same rationale we're using with the vaccines. For the few people who develop anaphylaxis to it, it's terrible and it's horrible. We shouldn't make light of it. But because it's safe for the overwhelming number of people, we should not withhold it from the public in light of how effective they are. And anaphylaxis is not avoidable. No matter what kind of a medication you make, no matter how safe it is, someone out there will be deathly allergic to it. And this is true even of something called normal saline that we use in the hospitals. Normal saline is essentially salt water. You can't get a safer product than salt water. And yet, there has been case reports of people who died from anaphylaxis after saltwater infusion. So anaphylaxis will happen. Now, I want to mention social media, okay? You want to be careful of the information you get through social media because there are many, many fake reports circulating of vaccine harm in social media. They have been, I've seen personally reports of people who quote unquote died from the vaccine. And when I did some investigative work, it turns out that it was completely made up. okay? Now, these are the cases that we can find that were made up, but there are a lot of cases where it's impossible to verify because you don't know who these people are, and you have no idea what the medical situation was, and you have no idea what their doctor thinks in terms of the relationship to the vaccine. You just see the sensational post. Person got vaccine, then died. End of story. And if you make a case like that, it's very easy for lots of people to share it, to like it, to repost it, and say, look at what the vaccines are doing. But understand that it takes a lot of information to verify that an adverse event was due to a vaccine and not due to something else. And frankly, on social media, anyone can make up any story. And I'm not saying all stories of these reports are fake, but what I'm saying is that there's enough fake ones out there that you have to take these with a grain of salt. And even if there were true reports of vaccine adverse events on social media, the fact that these are the only ones getting reported gives you a skewed view on overall safety. It's like everyone in the world who had deathly allergic reactions to bananas and mangoes got online at the same time and started posting their horror stories about what happened when they ate mangoes and bananas. If you've never eaten a mango or a banana up until that point, after going through their social media posts, you probably will be deathly afraid to eat these fruits, when in fact, it's extremely safe. So that's what happens when you have just these reports coming up. You have no way of putting it in the greater all context of what is the true incidence of this adverse event, if it is real. So that's another reason why social media is dangerous. There's also rampant misinformation and pseudoscience that goes on in social media, and that catches fire. And so you have to be very careful about the credentials of the people purporting to share information. And then this is a whole nother can of worms, but social media algorithms are designed to feed you what you want to see. So let's say that you click on a report of a young person who died after getting the vaccine, and you thought, oh my word, how tragic, this is terrible. Then suddenly you see another report pop up in your social media feed. Oh, that's interesting. Well, you're going to click that one too, and you're going to read it. Oh, how terrible, how shocking. But in the background, Facebook or whatever social media platform you're using is learning you and saying, oh, you like looking at these stories. So I'm going to fetch as many of these stories as I can, and I'm going to put them on your newsfeed so you can click on them more because I want you to stay on our platform longer. So then after a while of doing this, it seems like every other story you see on your newsfeed is stories of people with terrible vaccine results. And now you're thinking, everyone in the world is getting a vaccine side effect. This is a terrible thing. Who would want to get their vaccine? And this is exactly what's polarizing and dividing our country right now. In the middle of a pandemic where we can't talk to each other, we're divided by time and space, and all we have is our social media platforms, and the computer algorithm is feeding us things that trigger us, things that really bring out emotions within us. And this tends to divide more than unify us. And we all go down our separate rabbit holes and echo chambers, and we start thinking, people who don't think this way are crazy, and you can't see the other side. And so be very careful about the information you digest on social media, because it is not objective by any stretch of the imagination. So again, just like Dr. Jenn was saying, I recommend the CDC and these other websites as reliable sources of information. But I also encourage you to visit this YouTube channel. It's called MedCram, and it's hosted by a Seventh-day Adventist physician in Riverside, California. His name is Dr. Roger Schwelt. And it is filled with extremely good, reliable, and well-researched information about every medical topic under the sun, but now more recently, a lot about the coronavirus, the vaccines, frequently asked questions, and he talks a lot about natural remedies, ways to boost your natural immunity to reduce the chances of getting coronavirus, what to do if you get the coronavirus, how can you make the disease more mild. And so he embraces our Adventist health message, and he puts it out there in a form that is credible because it's backed up by evidence. And the CDC, the World Health Organization, the National Institutes of Health, and your state health board are also very good places as well. Okay, so I'm going to run through this very quickly because I know that the Q&A session will be getting a lot of these questions. But common misconceptions: I should trust God to protect me, not a vaccine. I should put my faith in God and not in man. Well, a lot of people who say this still wear a seatbelt when they drive. Why? If you are living by faith and not trusting in man, if you really trust in God to protect you in every area of life, why do you wear a seatbelt when you drive? In fact, why do you lock your door at night before you go to sleep? You see, friends, it is not a denial of faith to take proper precautions. Because when you come to the end of what you can do, you will begin to see what God can do. So when you don't avail yourself of the resources that God has made available to you, that's not faith, it's presumption. It's like driving without a seatbelt on and saying, God will protect me, I'm fine. So I view the vaccine as that way. The vaccine, God gave us our minds and our intelligences to come up with technologies like the vaccine. And we have data to show that they're effective. And you have that available to you if you're in the right age group and the right category right now. But if you have the chance to get the vaccine and you don't get the vaccine and you say, you know what, I'm just going to trust in God to protect me, you have to ask yourself, is this faith or is this presumption? Now, this is between you and God. I will definitely not say that everyone should get the vaccine, otherwise it's a presumption of faith. But this is not true. Because some people may look at the vaccine and say, you know what, John, it might be fine for you, but I still feel nervous about it. I feel like it hasn't been around long enough, and I'm not an early adopter for anything. I don't buy the first iPhone. I don't upgrade my software on my computer. I don't early adopt anything. I want to see more people get this thing before I will get it. And I am completely fine with that, and I respect that. So that is why I think vaccination is an individual choice, and it's between you and God. But I disagree with people who turn it into a moral issue and say, as a Christian, you must choose God or man. And if you choose the vaccine, you are choosing against God. That is where I say you are incorrect. So let it be an individual choice, not a moral issue. Okay, a healthy lifestyle or natural remedies will protect me. I agree with this to a certain point. I agree that if you boost your natural immunity, you decrease your chances of getting the coronavirus. But I have seen way too many people who are at the prime of health, who are practicing healthy lifestyles, still end up in the ICU on a ventilator because this coronavirus is something their immune systems have never seen before. So even though you will decrease your chances of getting infected, it is not 100%. So I don't think you should walk around thinking a natural remedy or living a healthy lifestyle is a substitute for a vaccine. So getting COVID-19 is better than possible terrible vaccine side effects. You might get some weird autoimmune disease 5 years down the road. You might have an arm growing out of your leg. You know, something terrible might happen. Well, Dr. Jenn hinted on this, but it turns out that getting the COVID-19 virus, we know, is terrible for many people in the long term, because a lot of people are developing long-term effects, side effects that are debilitating: chronic fatigue, pain, memory issues, and they're at the prime of life. Some people might have permanent lung damage. So compared to those well-documented side effects, the COVID-19 vaccines represent a very, very safe alternative. Okay, they're just experimenting on people, especially minorities. You know, they did this with Tuskegee. They're going to do this again. They want all the minorities to line up and get their vaccines first. The only way, the only thing I can do to address this is to tell people that there are very wealthy white celebrities and business people who are trying to cut the line in getting the vaccine and are failing. And they're trying to get this and they're not able to. So what I'm saying is that if the government was trying to experiment on different groups of people, then they're definitely doing a bad job at it, because they're excluding everyone in the same way in terms of vaccine shortages. So if you look at the vaccine trials as well, they enrolled representative groups from all the different major minorities that exist in our country. And so the safety data you can translate to all the different minorities that we see. And so with that, you know, minorities and people with comorbidities weren't included in the trials, and this is not true, because they were. These vaccines will manipulate my genes. I covered this earlier. They absolutely do not manipulate your genes. There's hidden nanotechnology in these vaccines that will hijack me at some point in the future. And I've seen conspiracy theories say that 5G devices will activate the nanotechnology that will hijack your frontal lobe, and you'll become a shadow of your former self. And the reason why some of these conspiracy theories run rampant is because of the word nano. The lipid particles, the fat droplets, are so small, they're called nanolipid particles. And some people just hear the word nano and they run with it. And suddenly you start thinking of tiny robots that invade your body. But this is not based on fact. This is based on fear and hype. The vaccines can't be trusted because they're all about profit. There is no question that these vaccines are big business for these companies. The companies are getting huge contracts with governments of countries around the world. They're raking in billions of dollars. There is no doubt vaccines are big business. However, just because they're making money off the vaccines does not mean that they're inherently untrustworthy. Let me give you an example. How many of you own a smartphone? If you own an iPhone or a Samsung phone, the companies that develop those phones are raking in billions of dollars. It's all about the profit. But will you say that you're not going to use the phone because the companies are making so much money off of it? Of course not. You judge a product on its own merits and you say, is it a good product? And if the answer is yes, regardless of how much greed and how much ulterior motive went into producing the product, you buy it because the product stands alone. It's a good product to you. In the same way, the vaccines have been tested and vetted by the scientific community, and they've determined it's a good product. So regardless of how much money the companies are making off of it is a secondary question to, is it effective for you and me, and should we get it? Now here's one. The Pope wants everyone to get vaccinated, so that's suspicious. And as Seventh-day Adventists, we tend to be suspicious about things that come out of the Vatican, okay? But did you know that the Pope also wants to end world hunger? And the Pope is also against the human trafficking. So just because the Pope is against these things, does that mean that we should automatically be for them, or vice versa? You see? So for people to throw conspiracy theories out there just because certain groups of people are promoting the vaccine, I think is short-sighted. And we should say, where is the science taking me? And is this ultimately a moral issue that I need to wrestle with? Rather than saying, well, because the Vatican likes it, I should hate it. So I want to end with Isaiah 26:3. You will keep him in perfect peace, whose mind is stayed on you because he trusts in me. In the midst of the anxiety that surrounds this COVID-19 pandemic, I encourage you, keep your mind stayed on God.